Hello, Oklahoma City. This is Gary Brooks. I want to tell you about my next project, and it has nothing to do with real estate. It's actually much bigger, and I believe far more significant than First National. When we opened that building in April of 2022, I was glad it was done, but I was very unhealthy. For 7.5 years, almost all of my focus and energy was invested in that project. Right in the middle of it, I had heart surgery in late 2019. I thought it was just stress, but later I learned that the lifestyle I'd been living for 30 plus years, high stress, poor eating, bad sleep, and not enough exercise, had been accumulating long before I stepped into First National. By the time we opened, I was 60 years old, and I felt I was going to die. I knew I had to do something to heal my body and mind quickly, or that building would be the last project I ever did. So I went all in. I started working out, reading everything I could find, watching anyone on YouTube who had real expertise in health and wellness. And I discovered something uncomfortable. Many of my opinions about health were just plain wrong. Things I'd believed for decades turned out to be outdated, oversimplified, or just completely false. I didn't know what I didn't know, and that's a dangerous place to be when it comes to your health. I also learned that the world of health and wellness is very chaotic. Everyone is an expert, and those experts disagree on a lot of things. Some of the bad information is intentional. Some of it comes from people who genuinely believe what they're saying, but just don't have the science right. By the end of year 2, I'd spent maybe 2,500 hours studying this stuff. I wasn't an expert on anything, but I was learning to weed through the noise. More importantly, I was getting healthier. My numbers were great, and I felt better than I had in decades. My mom died in the heart hospital in 2018, so I always assumed my heart issues were hereditary. Not much I could do about it, right? What I've learned is that most of what happens to us is well within our control. The things that caused my heart surgery were nearly all self-inflicted. Now, Oklahoma City is a great place to live, work, and raise a family. I've been here since 1980, and I wouldn't live anywhere else. But we're also one of the least healthiest cities in the country. There are plenty of national studies to back that up. From diabetes to heart problems to poor eating and lack of movement, we are not a healthy, thriving community. If you're like me, you've just accepted this as reality. It's the norm. But as I started getting healthy myself, I became very uncomfortable accepting that norm for my city. So I began asking, is there a way to change it? I've been working on a strategic plan with some very smart people that I believe can move the Oklahoma City Metro from one of the least healthy to one of the healthiest cities in the country by 2040. The kickoff event for this 14-year plan is the Oklahoma Health and Wellness Summit, March 9th and 10th, 2026. I'm bringing together some of the best minds in health and wellness right here to OKC for 2 days. These are people I've learned to trust over my 4 years of deep research. I have 2 objectives for every attendee. First, to empower you to become your own best healthcare advocate. You are the only person who knows what's best for you. We're going to give you tools to become the conductor of what I like to call your own healthcare orchestra. The second objective of the summit is to help you become a better patient for the doctors on your team. We want to give you the tools and confidence to ask better questions, understand what your numbers mean, and start applying the latest science to your own health. At lunch on day 2, Mayor David Holt and I will roll out a strategic plan to make Oklahoma City one of the healthiest cities in the country. It's bold, it's big, and I believe it's doable. Please go to healthycityinitiative.com to see the schedule, read about our speakers, and sign up. I'm bringing in experts from Seattle to Singapore, some of the top specialists in the world. We only have room for 420 attendees this year, so don't wait. I know what it's like to have an impossible dream. And with thousands of people pulling on the same rope, that dream became a reality. I believe this is a dream we can all get behind. So please go to healthycityinitiative.com, check out our list of speakers and our schedule, and sign up. Or send the link to someone you know who could benefit from our summit. Thanks for your time.